In this next lesson, we're going to talk about medical history, adverse events, concomitant medications, and physical exam. These are four very important case report form pages that we see in almost every clinical trial. And I can tell you that probably anywhere from 35 to 40% of the data discrepancies or queries that you discover in a clinical trial probably is associated with these four pages. So what we're going to do, our learning objectives, we're going to discuss these four, how they're similar, how they're different, what the relationship is between them. We're going to understand the relationships that exist between these four pages. We're also going to discuss how the data is collected on the case report forms, and we're going to review some of the common errors that we find on these case report forms. So the first page we want to talk about is the medical history page. A medical history is taken by the investigative site staff at the beginning of the trial. So the site is going to record this information on the case report form, documenting all the medical conditions of the subject and indicating if the condition was resolved or is ongoing, such as a chronic condition like diabetes, hypertension, asthma, etc. So normally what will happen, the subject comes in for their screening visit. The coordinator, which is probably going to be an RN, but it may not be an RN, is going to take their medical history. So the same, very similar to what you would do when you go to the doctor for the first time and they ask you questions about, have you ever had this, have you ever had that, does this exist in your family, that kind of thing. They'll probably have the subject complete a form that asks them some of that information. So here's an example of what a medical history CRF page might look like. As we talked about before, we've got our header information up at the top. So we have our subject initials, our subject ID, which is unique to that particular patient, and then we'll indicate the date that we recorded the medical history. So if you look at the form itself, you'll see down in the first column there, we have the various body systems. We have a head, ears, eyes, nose, and throat. We'll also indicate if there was any condition that was diagnosed, yes or no, what that condition was, what the onset date was, and whether or not it's a current problem. So as you can see, each of the systems there, neck, respiratory, cardiovascular, gastrointestinal, will go down that list and will indicate what conditions that particular patient has that they're either currently suffering from or that they have had in the past. And there may be some inclusion-exclusion issues related to that medical history that could potentially exclude them from participating in the trial. The next page is the physical exam page, or the PE page. The physical exam is taken at the beginning of the study. It could also be taken at various points during the study, depending upon the protocol. And once again, it's going to be a review of the body systems. So the CRF form lists the body system, and the site completes each of those systems. So we'll take a look at what that looks like now. So as you can see from our example, the physical exam page looks a lot like the medical history page. You have the body systems in the first column. Up at the top, you have your header information, subject initials, subject ID, the date of the exam. You'll also indicate the time of the exam and what visit it was at, if it was baseline visit or visit 1, 2, 3, whatever it may be. And then in the form of the body, or the body of the form itself, you have the body systems, which should be identical to the medical history page. And then you'll indicate whether or not it's normal or abnormal, or whether it was not examined. So if it's abnormal, we want to see some comments in the next column from the investigator performing the physical exam, and then we want them to indicate whether or not it is clinically significant, yes or no. That goes a long way to helping assess whether or not the subject is going to be eligible for the study. The next page we want to talk about is the adverse event page. An adverse event, or an AE, is defined as any untoward medical occurrence that's associated with the use of a drug in humans, whether or not considered drug related. So an AE can therefore be any unfavorable or unintended sign, examples such as a laboratory finding that might be abnormal or it might be unusual, a symptom or disease that's temporally associated with the use of a medicinal or investigational product, whether or not the event is considered causally related to the use of the product. So in other words, an adverse event is any change in the subject's current medical condition. It could be anything from a headache to a heart attack, and everything in between. Does not have to be related to the study drug. In most cases, it will not be related to the study drug, but it is important that we collect those during the course of the trial. So as the subjects come back in, we want to carefully assess whether or not they've experienced any adverse events, anything at all. It could be something as minor as just having some diarrhea, or having an upset stomach, or having a headache, or something like that we may think is pretty insignificant, but that can be very major in the course of a clinical trial if we get enough subjects that experience even a very minor adverse event. So it's very important that we collect all of that information during the course of our trial. So as you can see here, this would be an example of an adverse event page. And you can see the header information up at the top is the same as the other pages. You also have a form that's going to be completed, and this is what we call a log form, because it's not going to be completed just one time. It's going to be a running form, because you may have a subject that comes in for maybe their second visit and they have not experienced any adverse events, but then they come back for their following visit and they have. And then so you're going to kind of keep track of those as they come in for their schedule of visits. So if you look on the log here, you'll see that this is laid out in rows. So the first row underneath the header there shows the number sign. So we want to number each adverse event 1 through whatever the related number is. And then we want to record the date that it was reported. We also want to record what the adverse event was. Was it a headache? Was it a broken arm? Whatever it happens to be. Then we want to know what the start date is. Now the start date may not be the same as the date reported. In most cases it won't be, because more than likely you're going to learn about it after it's already occurred. So the start date's probably going to precede the date that it was reported. Then if they recovered from it, then we want to indicate the end date there in that column. As we move over to the right, we have outcome. What's the outcome? Did they recover from it? Are they still suffering from it? What's the severity? Is it mild, moderate, or severe? That's very important that we collect that. Also, the next column, we're going to indicate whether it was serious or not. A serious adverse event is one that is either life-threatening, requires hospitalization. That means were they admitted to the hospital, not did they go to the emergency room and they were sent home a few hours later. That would not be a hospital admission. Were they already admitted to the hospital and they experienced an event that prolonged their stay? Maybe they got an infection that prolonged their stay for a couple of days. That would be a serious adverse event. We also want to indicate whether or not it was expected. When the investigator receives the investigator's brochure at the beginning of the trial and any updated investigator brochures during the trial, it's going to indicate what adverse events are expected and which ones aren't. So they want to pay close attention to that because, say, for example, if say arrhythmia is something that's expected, they want to be very, very careful of that because that could potentially be a very serious adverse event. So we want to indicate if it's expected or not. The next column is going to be treatment. Did the patient receive some medication? Did they receive some other type of therapy as a result of that adverse event? The column next to that is going to be action taken. That's going to be related to the study drug. Did we discontinue it? Did we increase or reduce the dose? Or did we do anything at all? Then the column next to that, the PI is going to assess whether or not that adverse event is related to the study drug in their medical opinion. In most cases, it's probably not going to be related to the study drug, but it could be, depending on what it is. And then the final two columns are where the PI is going to indicate their initials and the date that they made their assessment of that adverse event. And as you see down at the bottom, you have a legend down there that corresponds with some numbers that would be recorded in each of those rows as the site completes that. That indicates what the values of those items would be. So the next CRF page that we want to go over is the concomitant medication page. We sometimes refer to this as the ConMed page. So a concomitant medication is a medication which the subject takes during a clinical trial. It's not the study drug, but it's a drug that's taken for either a pre-existing condition or it might be the result of an adverse event that they experience. It's prescribed by either their doctor or the principal investigator. And ConMeds can include medications that were started prior to enrolling in the trial and continuing during the trial, and medications that started after the subject enrolled in the trial. And we usually indicate whether or not it's something they were taking at the time they enrolled. Here's an example of our concomitant medication log. It looks a lot like the adverse event log. You have the header information up at the top, and then you have a series of rows that make up the form itself. So in the first column, you've got a number. We just number these sequentially. Then you've got the name of the medication, whatever it may be. You have the indication, which is the medical condition that they're taking it for. You have what the dose is, what the dose units are, the frequency. Do they do it once a day? Do they do it 4 times a day? How often do they take that medication? What's the dose form? Is it a tablet? Is it an ointment? Is it some sort of patch? What exactly is the form that it takes? Also, the route of administration. Do they take it orally? Is it something that they rub on their skin? How do they take it? And then next, you've got the start date and the end date. So if they're still taking it, they won't have an end date, but they'll have a start date on there. Then the next to last column, we would indicate whether or not it's a baseline med. If it's a baseline med, it's something that they were taking at the point they enrolled in the trial. If not, then it would be something they take afterward. Then is it continuing at the end of the study? So we wouldn't fill that column out until the subject completes the study and we indicate whether or not they're still on it. Down at the bottom, you have a legend that corresponds to the various pieces of information there that the site's going to record on the ConMed page. So next, we're going to talk about the relationship between adverse events versus concomitant medications. So as we talk about an adverse event listing, we see that an adverse event listing indicates that a ConMed therapy was given. In other words, the treatment column in our log page is equal to medication or some other type of therapy. So if that's the case, then our ConMed listing for the therapy must appear on the ConMed page. Also, the ConMed start date must be equal to or after the adverse event start date. If they're not, then that's a conflict. The ConMed end date must appear if the adverse event is resolved and must not exceed the end date. An exception to this would be in the case of an antibiotic. So when you go to the doctor and let's say you have strep throat or some other type of infection, then the doctor prescribes an antibiotic, and what does the nurse tell you to do? They tell you, take this for 10 days, even though your symptoms may clear up in a couple of days, go ahead, take the entire bottle. So they give you a 10-day supply. They want you to use the bottle up. So in that case, the adverse event, the end date, would precede the final dose date for the ConMed, and that's perfectly fine. In all other cases, that would be a conflict. So we want to pay attention to that. So what happens, our data management team is going to run a listing from our clinical database to show all the adverse events with treatment equal to medication or therapy. And then they're going to compare that to the ConMed page, and they're going to see if any discrepancies exist that they need to send the query to the site for them to clarify. So in what we've been talking about, our concomitant medication dates should be within the start and stop dates of the adverse event or pretty close to it. So let's take a look at an example here. So in our first example, we have an adverse event of headache that started on February 4th, 2013 and stopped on February 5th, 2013. And the subject took a ConMed for the headache. So the ConMed start date should be February 4th, 2013 or after, but should not be taken after February 5th. So if their headache went away on February 5th, they wouldn't still be taking the medication on, say, February 6th or some date after that. So in our second example, we have an adverse event of strep throat. The patient took amoxicillin, an antibiotic. The antibiotic was taken for 10 days and the infection ends prior to the 10-day period. In this case, the end date for the concomitant medication, amoxicillin, would exceed the end date of the strep throat infection. That would be perfectly fine. So that would be an example of where our end dates can conflict, but that discrepancy is okay. Many ConMed pages also include medical procedures in addition to medications, so these procedures should be recorded as well. Some trials will be set up to where your medical procedures are recorded on a separate page, but in most cases they're going to be on the same page as the medications. So an example of this would be the patient suffered from gastritis, and as a result they had a colonoscopy. So a colonoscopy would be recorded on the ConMed page, so we have a record of that. So now we have a relationship between a concomitant medication versus what's on our medical history page and our adverse events page. So we have a concomitant medication entry. The reason for the use or the indication must appear on either the adverse event or the medical history page. A medical history entry must include ongoing and not have a stop date. So that would indicate that they're still suffering from that medical condition. So an example of this would be we have a concomitant medication entry for metformin, which corresponds to an ongoing medical history item of type 2 diabetes. Another example might be a concomitant medication entry for Zofran, which corresponds to an adverse event of nausea. So anytime we enter a ConMed, we've got to have a corresponding entry on either our medical history or our adverse events page. So keeping on this same thread of reviewing our concomitant medications versus medical history and adverse event, a concomitant medication should begin on or after the AE start date. Any discrepancy is going to be queried for the site to clarify those dates. Then the CONMED stop date can be present even though the adverse event or the medical history entry is ongoing. This might indicate that the patient was switched to some other type of therapy, or that the concomitant medication may be on the study disallowed medications list, which sometimes happens, and then they have to switch therapies. Also, the concomitant medication stop dates may extend past the AE stop date if the medication is an antibiotic. So if a concomitant medication is entered and the indication does not appear on the ongoing medical history page or the adverse event page, then the sponsor is going to query the site for that discrepancy and get them to fix that or clarify that. Our medical history example shows ongoing as a current problem, yes or no. Another issue that's related to concomitant medication pages is that sometimes concomitant medication pages will ask if the medication is used for prophylaxis or prevention, yes or no. Now, this can be done a couple different ways. Some sponsors want the prophylaxis medications listed on the concomitant medication page, and some don't. So some sponsors may request that prophylaxis entries on the CONMED page should correspond with a medical history entry. Sometimes they don't. You get into other issues of whether or not vitamins and supplements should be listed on there. Normally, the sponsor will have some type of guidance on whether or not they want sites to record those on the CONMED page. An example of this might be a concomitant medication, omeprazole, is entered for prophylaxis for medical history of heartburn. You could clarify how to record prophylaxis medications. So that'd be one example of something that's given for prophylaxis for a medical history entry that's already there. We can also have a relationship between the ongoing medical history and our adverse events. So, for example, we may have an ongoing medical history entry can appear on the adverse event page if the condition worsens during the course of the trial. So the AE entry should include the word worsening in the description if this is the case. So, for example, we have hypertension appears on the ongoing medical history page. The patient's blood pressure increases during the trial from the baseline, recording indicating that hypertension is worsening. So the PI may adjust, may increase or adjust the medication as a result, and the medication adjustment is recorded on the concomitant medication page. So any discrepancies that result in the site being queried to confirm that medical history is indeed worsening. So we want to make sure that anything that worsens over the course of a trial, we get recorded as an adverse event. We also want to take a look at the relationship between the physical exam versus the medical history and the adverse events pages. So if we review the physical exam page with the medical history page, we want to review those for any discrepancies. For an example might be in the physical exam, the PI indicates that a surgical scar was noted in the physical exam, but there's no surgical entry on the medical history page. So that would be a discrepancy that we want to query for. We want the site to clarify that to make sure we have that information correct. So further on our physical exam versus medical history and adverse events, we want to compare the current physical exam page with the past physical exam pages and see if there's any changes. The changes could result in an adverse event. Any abnormal physical exam entries should have a corresponding adverse event entry, and then the adverse event entry start date should be on or before the date of the physical exam. So our data management staff will run a listing for any abnormal physical exam entries, and they'll compare that with the adverse event entries. And if they discover any discrepancies, they'll likely send a query out to the site for the site to clarify that. So now that we've gone over the medical history, the adverse event, the concomitant medications page, and also the physical exam page, we want to take a look at the relationship between these 4 pages and some of the data discrepancies that we're likely to encounter as we start reviewing them. So what I want you to do is go to the Sample 1 folder in Moodle and print out a copy of each of these pages. You'll have one for medical history, AE, ConMeds, and also physical exam. As you print them out, you'll notice that they're completed. They have some data on them. So I want you to print those out, and then I'm going to go through them in this video so that you'll begin to see where some of the discrepancies are. And then what I want you to do is go find the others, and then I'll post out onto Moodle a little later in the assignment, some of the answers that you're going to likely discover in that. So as you've got your pages printed out, let's take a look at the adverse event page first. And you'll see, as we've gone over previously in the lecture, that we have a series of columns on here. You can see up at the top, you've got some header information, and this is going to appear at the top of each of the pages. And then, as you see, this is a log page, so you've got a series of rows here, and you can see that there are 6 adverse events that have been entered for this particular subject. So each row is identified in the first column, 1 through 6, that identifies the adverse event. And then you've got the next column indicates the date reported. In this case, it was April 7th, 2013. Then you have a description of the event. In the first row, you have abdominal pain. And then you have a start date and a stop date, or end date if there is one. And then in the very next column, you see outcome, which is, if you look down at the bottom, you'll see a legend down there. So outcome could potentially be fatal, intervention continues, not recovered, or recovered. And then those numbers correspond with what's listed in that column. The next column is going to be severity. So severity can be anywhere from mild all the way up to fatal, depending on what it is. Then the next column is serious. Is it a serious adverse event, or is it not a serious adverse event? Most of them will not be serious adverse events. In order for it to be a serious adverse event, it has to be life-threatening, it has to result in a hospitalization admission, or it has to prolong a hospitalization admission that's already in place. The next column indicates yes or no. Is it expected or not expected? We find that from the data that's in the investigator's brochure. The investigator will kind of be clued in on what adverse events to expect and which ones are not likely to be expected. The next column is going to be treatment. Did they receive a med? Did they receive some type of procedure to help treat that adverse event? And then the next column is going to be action taken. This is going to be action taken with the study drug. Did we discontinue it? Did we interrupt it? Did we either increase or reduce the dose? Then the next column is going to be related to the study drug. That's going to be a yes or no. Is it related? Is it not related? Possible? Probable? The investigator is going to make that assessment. And then the last 2 columns are going to be columns for the principal investigator to record their initials and the date at which they assess that particular adverse event. So if we were to look at the first row here for abdominal pain, we can already see one discrepancy that occurs because we have in the outcome column, we have 3. And if we look down at the bottom, outcome of 3 equals recovered. However, there's no end date. The end date is blank, but the outcome is recovered. So if they've recovered, there should be an end date there. So that's automatically a conflict right there. So that's going to be the first conflict that we see. So let's move over to our concomitant medication page. As you can see, this looks a lot like the adverse event page. We have our header information at the top. Then we have a series of concomitant medications that have been recorded on this page. You'll see the name of the drug or medication. You'll also see the indication, what it was given for. Then there's dosage, dose units. There's going to be the frequency. Was it once a day, twice a day? Whatever that may be, whatever the dose form is. Was it a tablet? Was it a capsule? Was it something suspension? And then you also have start and end date, and then you indicate whether or not it is a baseline med or not. So any medication that they're on at the time they start the study would be a baseline med. If it's something they start, after the study has progressed, then there would be that would be a no. And then finally, the last column is going to be continuing at the end of the study. If we get to the end and they're still on that med, we'd indicate yes or no, depending on what the condition was. So let's take a look at our medical history page. You can see it's filled out. It has the header information up at the top, and then we've also got some medical history items that have been indicated here. So in this case, this patient has medical history of asthma, also a history of arrhythmia. They also had a colonoscopy back in 2010. They've also got a history of scoliosis. They've got migraine headaches, and they have some seasonal allergies. And then you can see the onset date there in the next column. And then the last column indicates whether or not it's a current problem or is it something that occurred in the past that they're no longer suffer from. So it's important that we get as much medical history as we can from the subjects when they start, because that helps us as the study progresses. So then the last page we're going to look at is going to be the physical exam page. It looks a lot like the medical history page. So once again, you have your header information at the top. You also have the date and time that the physical exam was performed. And then we have each of the major body systems listed there in the first column. And then the next column indicates whether they're normal or abnormal. If they're abnormal, we need to see a comment in the third column. So in this case, we see that the patient wears corrective lenses. And then we also want the principal investigator to indicate whether or not that is clinically significant. So in this case, it's not. So they've indicated that it's a no. So you can see the medical history items that have been listed there. And then down at the bottom, we see that the principal investigator signed the form and dated the form for when that physical exam took place. So we do want to see the signature date and the date of the exam. They should be the same. There should not be a case where those dates would be different. So at any rate, what we're doing as we start to review these pages, if we go back and look at the adverse event page that we started at, we saw there was a discrepancy between outcome and end date. You'll also notice that if we have start and end dates for these adverse events, they also need to match up with the start and end dates for our concomitant medications. So that's going to be an area where you can potentially get some conflicts. So for example, if we look at adverse event page line 5, which is hypokalemia, we see that there's an end date on here of April 30th, 2013. However, we've indicated that the subject got a medication for that. So if we go look at the ConMed page, we'll see for hypokalemia, which is going to be line 6, they were given potassium chloride. And then here are the doses and all the other information there. However, we have an end date that's blank on there. So in other words, the adverse event ended, but the medication did not end. So that would be a conflict. Ordinarily, when an adverse event finishes, you're going to have a completion date that's pretty close to that date. Normally, it will not be over that date. It would be before the date. So they may have, say, for example, if hypokalemia ended on April 30th, they may have ended the medication, say, on April 28th. They shouldn't be continuing the medication after the condition has ended. And the only time that would not be the case is if the subject is taking an antibiotic, where they might take it for a regimen, say 7 days or 10 days, and then the infection probably clears up prior to that. So that'd be one example of where those dates might not conflict. So anyway, what I'd like for you to do is to take these pages, print them out, go over them, take about 30 minutes or so, go over these and see if you can find all the discrepancies that you can find on these as you review them. There should be about 11 or so on here. What I'll do, I'll post out a little later on Moodle all of those discrepancies, so you'll be able to see them. But the easiest thing to do is just take each of the pages, kind of line them up on your desk, and then kind of review them sort of one by one, and go through there and see if you can pick out as many of the data discrepancies as you can. So at any rate, go ahead and have fun with that, and I'll put the solution out there a little bit later. So I hope you've learned a few things about the relationship between the medical history, adverse events, concomitant medications, and physical exam CRF pages. So your Moodle assignment for the week, I want you to read Chapter 11 and Practical Guide to Clinical Data Management, which is collecting adverse event data. And then I posted up on the discussion board the following questions. So based on what you've learned in class and from your readings, why do you think that collecting adverse events is important in a clinical trial? So there's no right or wrong answer there. I want to hear from you and hear from all of you in that. So if you share whatever you want to based on what you've learned this during the course of the lectures and in the course of the reading. So go ahead and get that up there this week, and then respond accordingly to your classmates. Then your second assignment this week is going to be a CRF data entry exercise. So in the Sample 2 folder on Moodle, you'll find a description of the exercise. You'll also find blank pages, blank CRF pages for demographics, adverse events, medical history, ConMeds, PE, vital signs, drug dispensing, and inclusion/exclusion. So I want you to read through the scenario. It won't take you very long to do it. Probably take about maybe 30 minutes. Read through that. I think it'll be fairly self-explanatory. So all you're doing is you've got a scenario where a subject comes in for a clinical trial, data's collected, we want to record that data on the CRF page. So everything that you need to record that data, each of the data items on the CRF pages, is listed in the scenario. So if you have any questions about it, put the question out there on Moodle. I think it'll be fairly self-explanatory, but if you do run into any difficulty, certainly let me know. Good luck to you. I'll put you'll have a spot to submit that out there on Moodle. So I'll expect you to have that done, before next week's assignments begin.